Welcome to Lakeview Health podcast series. I'm Mandy Jack, the Clinical Director of Lakeview Health. And with us today we have Dr. Louise Stanger. Dr. Stanger is a clinician, an interventionist, educator, also author of 2 different books. And we would like to thank you very much for joining us today.
Mandy, I'm just honored to be here and to get a chance to visit Lakeview, meet your staff, and meet some of the most wonderful community people. So thank you.
You're welcome. We're excited to have you. Can you tell us a little bit about how you got into this field of work?
Yes, I'd be happy to. So, not unlike many other people, I was born into a family that was beset with mental health, substance abuse, and other disorders. And as a professor, I was invited to be the person that developed the first graduate seminar in substance abuse for social workers, later marriage and family counselors, psychologists, and public health. And as I was doing that, I invited in a gentleman who came to speak. And he was as short as I am. He was that tall. And his name was Frank Picard. And he had written a book called Family Intervention, which at that time, just to locate you, was in the 80s. And that was the time when Vern Johnson, who we talk about being the grandfather of intervention, had written. And he was a colleague of his. And when he spoke, Mandy, I have no idea if anyone in my class listened, but he talked about my family. And I had always been good with crisis. You give me a crisis and I am just Johnny on the spot. And so from there, I really learned how to do interventions. He supervised me, even though he was in Portland. And my love of taking a look at substance abuse and mental health disorders continued to grow. As a professor, I had many grants in alcohol and other drug prevention, the last one being a parent-based intervention to reduce high-risk problematic drinking. And I had been a licensed clinician since 1973. But about in 2008, I was getting antsy. I was getting itchy. I wanted to do more, and I wanted to be more in the public eye. So I got much more involved in the direct treatment and addiction field. And what an honor to be involved in that.
Mm-hmm. Excellent, thank you. Can you talk to us a little bit about your interventions?
Interventions. So interventions to me are merely invitations to change. Mm-hmm. And every day we are always inviting people to change, whether it be in a hospital, whether it be because of legal, whether it be because of school. And one of the things that always surprised me when I did get more involved in the field, where there were all these people that said they had these different models of intervention. Mm-hmm. So let me first say, to me, it's an invitation to change, and it's a process. Mm-hmm. It is not a model. And anybody who's really good as a clinician will always violate whatever model they have, because really what they want to do is start where the client is. That being the case, people call me and their hearts are breaking. They haven't slept and they're worried about a loved one. Nobody calls me up because they're feeling terrific. Mm-hmm. No one will call an interventionist. And at that point, you really have to do a little bit of engagement and see whether I'm the right person or my team is the right person, because I don't do interventions alone. Mm-hmm. I think that's foolhardy. And I also do what's called an invitational approach, meaning that the moment you and I are engaged, and say you're a family member worried about a loved one, Mandy, I could say, it's fine for you to tell Joe or Sally that, you know what, this family's got a problem, or we're finding a solution, and I've started working with Dr. Louise. And at that point, what I'm going to be doing is doing some interviewing. Mm-hmm. And I use a qualitative research method called portraiture. Portraiture was developed by a woman named Sarah Lawrence Lightfoot. She's African American, and if you want to read more about her, it's the art and science of portraiture. Mm-hmm. She's the only endowed chair at Harvard that has a chair in her name. And I learned about her when I was doing a dissertation. Mm-hmm. So that's how but really it is open-ended questions. Tell me about your loved one. Tell me why your heart is hurting. What's special about them? And what are your hopes? And at the same time, I'm going to start scribbling with your piece of paper, and I'm going to be doing a family map because I'm really interested in family history. And so I'm going to gather information, and I'm going to ask whoever my first caller is after we engage, who else cares about Sally or John or Joseph? Who else is important? And they may tell me some more relatives. Are there any friends? Because invariably, there's always an outlier. Always that person that you don't think cares about that person is the one that can really bring them to change. So then myself or my teammate, we will start interviewing, and we'll interview individually. And the reason we're going to interview people individually, which does take about an hour, but it's not long, is we want to get a portrait of this person. And we also are at the same time assessing family members or friends to see what their substance use is, to see what their mental health issues is, because we're bringing people together for the common good. And the common good is to help invite someone to change. And then we're going to set a date, a time, a place. We're going to do a pre-intervention in-house meeting, and we're going to invite someone to change. And we're going to invite them. But there's a lot of back work that takes place. And yes, most of the time, people will say, well, they'll never come. We can't really tell them. And we go, yes, you can. Because you really want to be respectful. And you don't want to come in and sabotage or be disrespectful. And so there's things about settings, about safety issues. There's a lot that takes place as you're inviting someone to change. And then the way I work, which is really small, is that I also want to do case management. But most of all, I really also want to work with this system. So I work in a concierge fashion. So we'll set up team meetings. They'll be weekly. But anyone on that team can reach out and at any given time and call me. So, and obviously we do have an invitation to change meeting. And in 97% of the time, we're aiming to get to yes. Does yes always occur within 2 minutes? No. Sometimes it takes longer than other times, but no one engages just to show up for an hour.
Thanks. Sounds like a really excellent approach.
Thank you. I think it's a social work approach. I think that all the people that have all these different approaches, if you really take it, it's a good systems approach. It takes a look at family history. It's respectful, compassionate, and it starts where the client is. So, and also you have to be flexible.
Right. And
you have to be able to be nimble. So if you're not wed to a certain model, you're able to really still hear that person.
Right. Great. So let's talk about the books you've written. Can you tell us about the 2 books and what really inspired you?
Well, the one book is very short and sweet, and it's called Learn to Thrive. And what I wanted to do is offer to people, not everybody can afford an interventionist, or can they afford, treatment. So I just wanted to tell them some of the ethical issues if you're looking for an intervention, is what an intervention is, so they could have that handy. So that's just really a downloadable book off of my website. And let me clarify that before I wrote a book, I've written as a university professor, I had to write a lot of referee journal articles. But I always felt that I wanted to do things that the public could consume. And my first experience with that was not in the addiction field, but was in the sudden death, grief, and loss field. I did work on, and I think I have to clarify that before I talk about this. Sure. I did work on what happens to women who are widowed at a young age. And the reason I did that is I had been a 3rd-generation widow. And that's really where I first used portraiture as a means of inquiry. And from there, I developed a website on women who were widowed and some of the characteristics of it. And that's because I didn't want it buried in an academic journal, because you get buried in academic journals. And who's going to read them? And from there, what I learned was that when 9/11 happened, the Columbia School of Social Work reached out to me, or actually young journalists did, because I was the only one in the country that had written qualitatively about women. And we all know with 9/11, people didn't know what to do. Yeah. And the gift they gave me was I was allowed to go there. But it was really by virtue of public. So many people had asked me, write a book on how to help families. 10 easy ways to help families. That's always the big thing. And I'm 70. And when I wrote this book, I was 68, turning to 69. And I thought, I just can't do the 10 easy things for family. But what I can do, which is very different, is I can share my memoir. But I'll do it in a non-linear fashion. And I'll weave in about families. Mm-hmm. So I wrote a book called Falling Up, a memoir of renewal, which speaks to, in part, my life, but it also speaks to family. And it also, in some ways, teaches how you do portraiture and teaches how you work with families, in the hopes that that might inspire someone else. Also with the notion, very clearly, that life is a series of episodes, sort of like Humpty Dumpty's falling down. But you always have that possibility to fall back up. And what does that take? And what are some of the strategies? And who can help you do that? And that really is the gift. So so that's why I did that. And to do it, I had, we're in an office now. So this is 13 by 6. I created a storyboard of pictures. The whole corkboard. I just took it down because I've got to write a new book. And also the story's changing.
Yeah.
And that was my storyboard.
Interesting. Well, thank you very much for taking the time to talk with us today. We really appreciate you being here. If you would like more information about Dr. Stanger's books, you can visit her website, which is allaboutinterventions.com. If you would like more information about Lakeview Health, you can also visit our website at lakeviewhealth.com, or you can reach us 24 hours, 7 days a week at 866-887-0142.